People who have had COVID-19 don't need 3 vaccine shots. And who is this article by? Dr. Philip Krause. Philip Krause is a former deputy director of the FDA, Office of Vaccine Research and Review. I think he resigned. Could you look that guy's name up?
Yeah.
I think he resigned over the boosters. Could you look that guy's name up? Paul A. Offit. He's a professor of pediatrics at Children's Hospital of Philadelphia. We're going to Philadelphia on the 20th of February, this Sunday. We just added a second show, and you don't have to have a vaccine passport to come to the show. Luciana Borro is a senior fellow with the Council on Foreign Relations and a former acting chief scientist at the FDA. So Luciana Borro, Paul A. Offit, and Philip Krause. Did you find out who Philip Krause is?
He left.
He did over the...
Yeah.
When?
August 31st, 2021.
So could you look up the story and find out if he left over protest over the boosters being...
Leave agency decision on, the vaccine.
Yeah, so this guy seems to have some integrity. So this guy has integrity.
Over the boosters.
And so now he's writing an article, and the Washington Post is printing it. That's how behind, that's how, So this guy was on this in August of last year.
Yes.
And we reported it at that time, and people just ignore it. So my friends who I like to call the lockdown left, just they're ignoring everything because somebody is pressing their fear button. And that's it. They get their fear button pressed, and that's it. They stop thinking logically, and they become tools of the establishment. Some of my really good friends, a lot of them are now my good ex-friends because they decided to be my ex-friend. I didn't stop being their friend. They stopped being my friend.
You know what was amazing is they got somehow people to they're like, don't do your own research. That idiotic thing that people...
What are you going to
read?
read?
Mid-level intellect. And then they somehow merged, like what people think the virus, I think they imagine that guy with the Viking helmet and the and the face paint at January 6th is they somehow merged that into one entity. So this is like, that's what they're doing with the truckers, is trying to merge it. Somehow it's January 6th.
January 6th, yeah. So Omicron spread is slowing in the United States, but more than 200,000 people a day are still getting infected by the coronavirus. 2 factors help to shape both the likelihood of infection and the severity of the disease: whether someone has been vaccinated and whether they have been previously infected. Public policy, however, has largely neglected the second factor. The Centers for Disease Control and Prevention, for example, recommends a 3-shot regimen for all Americans 12 and over, regardless of whether they have had a previous infection. But requiring people who have been infected to get 3 shots is overkill at best, a waste of valuable doses, and an unnecessary risk at worst, given that vaccines have side effects, albeit rare ones. This is in the Washington Post. Do you imagine how bad it has to be for the Washington Post to print this?
Yep.
Do you imagine how bad it has to be? And the CDC, by the way, I have to tell you, they're against this. They don't agree with this article. So I got to tell you that, or else YouTube will take down my channel. Many companies now demand that their workers show proof that they've had 2 shots and a booster, or 1 shot of the Johnson & Johnson vaccine plus a booster, regardless of previous infection status. Allowing workers to submit documentation of a previous infection plus 1 additional shot would not only align mandates with the best research, it might also reduce resistance to vaccination. After all, it's easier to persuade people to get 1 shot than to get 3. So they're saying this would reduce vaccine hesitancy. If you allowed people to substitute their natural immunity they get from getting the virus, that would require less vaccines for them. That would actually reduce vaccine hesitancy. But of course, the government does it the exact wrong way. But we're not allowed to contradict the government here at the YouTube, or they'll take our channel down. So we have to say the CDC is doing the right thing here.
We're just telling on the Washington Post for some.
Yeah, I'm tattling on the Washington Post. So I hope YouTube takes down their thing. The research has long suggested. What? The research has long suggested that even unvaccinated people who become infected acquire substantial protection against both symptomatic disease and future hospitalization for COVID-19. For example, In one major study, over 30 million people in California and New York posted last month to the CDC's website unvaccinated people with a previous infection as of the week beginning October 3rd were 29 times and 14.7 times less likely to be infected than an unvaccinated person with no previous infection. Hospitalization rates showed a similar pattern. So it looks like you get a lot of immunity and protection against the virus from having the virus.
This was like common knowledge.
This has always been common knowledge.
I mean, it's amazing. That's a thing everybody... It wasn't like only smart people knew that. That was a thing everybody knew.
Everybody knew this, exactly. So but again, if they can make you think that a Nobel Prize winning medicine that's on the WHO list of essential medicines is a horse poison, they can make you believe anything. They can make you believe that natural immunity isn't worth anything. They can make you believe Joe Biden isn't demented. They can make you believe mandates are constitutional. Go ahead.
Do you remember when I still remember this? My mom, this is even going back years ago, but she's like, one marijuana cigarette is like smoking 100
regular
cigarettes at once, or just all the things you hear about drugs, that aren't good for you necessarily, drugs that they lie about.
Yes.
They used to say things were a gateway. The gateway is you lie. You lie all the time.
That's right.
And then people go, I wonder what else you're lying about.
Well, when I found out they were lying about ivermectin, that it wasn't horse poison, then I was like, I got to look at everything else they're saying around the COVID policy. And every time I looked at something they were saying, they were lying.
Yeah.
They were lying about herd immunity. They were lying about masks. They were lying about funding gain of function. They were lying about where the virus came from. They're lying. They're lying about natural. They're lying about everything. Everything.
Aaron Rodgers.
Go ahead.
I heard Aziz doing a joke about Aaron Rodgers making the wrong decision.
Yeah, good. He's a good boy, Aziz. He's a good boy.
Yeah,
he got his mind right. He's a good boy.
He goes, he's one of these guys that does his own research, we shouldn't be surprised a football player made the wrong choice. First of all, you don't think a football player, a professional athlete, they're hyper aware of every little thing that they put in their body.
Because their body is their moneymaker.
Yeah, you don't think that they would know probably better than Aziz, master of none, and sorry. I don't even dislike Aziz, but I mean, that's everybody said. I don't even single him out.
I don't know him personally, but I have met him a few times, and each time it was very off-putting. So in another study of Israel, I don't know. Do you know him? I don't want to put you on the spot.
Yeah, I know him from when he started.
I won't put you on the spot. If in another study of Israeli citizens, August to September, previous infection conferred greater protection against future infection than did vaccination alone. What?
So Aaron Rodgers is right.
So sounds like it. Sounds like Aaron Rodgers was right. And this protection was further increased by a single vaccine dose. Recent findings from Qatar affirmed that previous infection also gives high protection, about 88% against severe disease caused by the Omicron variant. Sounds pretty good. In fact, the research shows that hybrid immunity, meaning immunity achieved by a combination of vaccine and infection, is stronger than immunity from vaccine alone, regardless of whether infection or vaccination came first.
So if you got 3 shots and COVID twice, you should be a superhero by now.
Oh, you should be able to dive into a pool full of COVID. It is clear that the cellular immunity, the arm of the immune system that protects against severe disease and helps generate long-lasting immune protection, that is clear that the cellular immunity cross-reacts among all of the variants. And emerging data suggests that vaccinated people who become infected with Omicron acquire an even broader cellular immunity than vaccinated people who have not been infected with Omicron. So this is indicating that you will get even a little better protection from having the virus than you would from. That's what that's saying. I'm not saying that's correct. I'm saying that's what that's saying.
Who's saying this?
Who's saying this is this new study.
Oh, okay.
So there was a research shows. So this is the Washington Post saying it. Those doctors I showed you, remember? They wrote this article. The biggest worry about Omicron has to do with its increased transmissibility. Could providing 3 vaccine doses to people with previous infection cut down on viral spread? There's no reason to think so based on current research. That's the people who are at the top of the FDA and left over the boosters telling you this. In any case, we already know that vaccination alone can't reduce transmission. Without oh my God. Can you believe that? I got in trouble.
Concomitant?
I got in trouble from YouTube for saying just that last year.
Yeah, right.
They go, you can't say that. I go, what the fuck? It's true. They go, you have to provide more context. What kind of context do you need to know that if you get the vaccine, it's not going to stop transmission? They go, well, you have to say it reduces the transmission. Well, I go, show me the science. They didn't.
You go, can I at least show Joe Rogan saying the N-word unconnected? And can I at least do that with no context?
In any case, we already know that vaccination alone can't reduce transmission without concomitant. I don't even know what that word is. Concomitant measures such as testing, social distancing, quarantining after exposures, and diligent use of high-quality masks. So what this is saying is that vaccination can help reduce transmission, but not alone. You have to use it with all these other things. That's what they're saying. You need to use testing, social distancing, quarantining, and high-quality masks. That's what I get out of that.
Yes.
Kurt's getting a funny look. He's not sure. Given what we understand about the immunity caused by infection, policies that rigidly require 3 vaccine doses, policies promulgated by a growing number of businesses, healthcare systems, and universities simply don't make sense. And that's coming from the people who walked out of the FDA on principle over the boosters. In some cases, people are losing their jobs because they believe, reasonably it turns out, that having been infected, they are well protected against the coronavirus and are no more likely to transmit it than their vaccinated and boosted peers. They prefer not to receive an unnecessary dose of a medical product. Sounds reasonable. No, they're going to call you a terrorist, a white ringer, a white supremacist, a racist, and they're going to slash your tires, cancel your insurance on your truck, and freeze your bank account.
Justin Trudeau doesn't even know why we're tolerating you.
Why? Yeah, right? Why are we tolerating you? Mandatory 3-shot policies are particularly problematic in the university setting, given that young men are at the greatest risk for the vaccine side effect, myocarditis. Booster mandates can also conflict with medical considerations. Many physicians recommend against receiving a dose of vaccine immediately after a coronavirus infection because they reason that it might not work as well.
I know people who did that, by the way.
I know that Dr. Drew did that.
They got COVID again. Yeah.
And then Paul Gilmartin did it. He got COVID, then he got his vaccine. Dr. Drew had a horrible case of COVID where he had long COVID and he couldn't get, and then he still got his vaccine after that. Here, booster mandates can also conflict with medical considerations. Many physicians recommend against receiving a dose of vaccine immediately after a COVID. However, booster requirements often do not allow for such subtleties. So they don't. They don't. Anything that would have stopped Pfizer or Moderna from selling one less vaccine to the government to stick in your arm, it seemed like anything that would have caused that, they didn't talk about it. They didn't tell you about it. In fact, they didn't. Mandating boosters for people who have been infected with the coronavirus means that unnecessary vaccine doses may be given to many tens of millions of Americans. These are wasted doses that could otherwise go to people who really need them, including outside U.S. borders. You know, the WHO has all along been screaming against booster shots. You don't know that, though. Steph, could you go to the WHO website,
Yes.
put in WHO boosters advice?
You got it.
And I wonder if they're still saying that, because they were saying that first world countries like the United States, they were advising against booster programs And instead, they wanted those vaccines to go to third world countries and poor countries that didn't have any vaccines.
Right. I had 3 helpings. Not even getting 1 helping.
Yeah. Any
Still looking.
Okay. At least 70 countries continue to have vaccine coverage rates below 40%, increasing the likelihood of serious illness in those nations and the emergence of more variants globally. Okay. It would be very simple for public health authorities, including the CDC, to acknowledge that a coronavirus infection is at least as protective as 2 doses of the vaccine. Were that to happen, businesses enforcing vaccine mandates might require no additional shots of people who have had COVID-19 if the goal is full vaccination, or 1 additional shot if the goal is up-to-date vaccination. So there we are. So now you know the rest of the story, and it's written in the Washington Post, and it's written by smarty pantses. These 3 smarty pants people. And if you have COVID, turns out you don't need a booster. Turns out you might only need 1 shot. That's what they're saying. But of course, so just imagine. I mean, this guy walked away from the FDA over this, and of course, that got almost 0 press.
He's been talking about this a lot. It's not just him. A couple people walked away.
I think also him and the other. I think it was this woman. Maybe whoever. I know what it was.
It was a woman.
It was the person who was the head of the vaccine.
He's the deputy.
A vaccine research office at the FDA.
I remember the episode because you showed Jen Psaki saying, "Oh yeah, go out and get a booster," and then you cut to Walensky from the CDC going, "No, only if you're over 65 because it hadn't been pushed through yet."
Yes, remember that
on the same day. Yeah.
Yeah. Any.
Well, I had one thing that says that the WHO says no evidence healthy children and adolescents need COVID-19 boosters. That's one thing that I came up with, but I'm still looking. You'll probably find it immediately.
WHO repeats warning against COVID boosters for healthy people as U.S. weighs wide distribution of 3rd shots. What did you Google?
I did WHO 2022 booster shot recommendation.
Okay, WHO reiterates warning against COVID boosters for healthy people as U.S. weigh third. The WHO strongly opposes the widespread rollout of booster shots, asking that wealthier nations instead give extra doses to countries with minimal vaccination rates. The U.S. has already admitted this is an article from September 21st, 2021. So they've been saying this. The WHO has been saying this, and I know it all along. And
I think changed since then.
I think they're going to get kicked off YouTube. So it doesn't say it opposes; it says strongly opposes. That was in September. So let's see if we can get a more up to date. Here's one from December 22. So that was from September. This is from December of 2021. WHO warns against blanket boosters as vaccine equity. So just in December, that's December 22nd. So that's little less than 2 months ago. Repeated COVID boosters not viable strategy against new variants, says the WHO. That's January 12th.
So rather than giving it away to some poor countries,
give it to another rich guy.
Make some people.
Give it to Keith Olbermann.
Yeah, have
Keith Olbermann get his 40th booster. WHO's warning on repeated booster dose vaccine strategy for new variants. That's January 11th. Booster campaigns won't end the pandemic. WHO chief warns. That was from December. January 13th of this year, it says WHO warns that repeated booster shots are not sustainable. So it's good to see the CDC and the Washington Post and the rest of the fucktoids catching up to the Jimmy Dore show, who's been saying this shit since I first started looking into COVID. Since I first started looking into COVID, we figured out you can't vaccinate your way out of this, that vaccine passports and mandates don't make any sense, and that everybody's going to likely to get COVID anyway. no matter if you're vaccinated or not. We've known that since last summer, right? Since we started looking into it. Everybody's going to get COVID likely no matter what. So, and this is the stuff that the lockdown left doesn't, they know it, they just ignore it. They just ignore the science. They, just like when I was a kid, right-wing Christians used to deny evolution. It's the same thing. They deny the actual science on COVID. If you ever talk to a lockdown left COVID person, they talk in circles. They don't talk. They never answer the question you ask. They always say, they go, hey, if you can spread the virus even if you're vaccinated, why would you need a vaccine mandate? Well, because you don't get as sick. That has nothing to do with transmission.
Because it slows the spread is the one I would get.
That's what. Oh, that's because of the hospitals clogged up. How come they haven't added an ICU bed in 2 fucking years?
Well,
right, and because what they tell you?
What's it clogged up with, the hospital? Other people who aren't vaxxed or people who are vaxxed? Like, what are you talking about?
So you're gonna mandate somebody not to stop you from getting a virus, but to delay you from getting it. That's worth mandating a medical procedure?
Saying slows down means nothing.
Nothing.
It's got to stop it, or there's
so I'm gonna get it, right? So the whole slow the spread thing, the only thing that would be relevant to is that, oh, you don't want to clog up the hospitals, which we've debunked that argument here a million times. They haven't added a goddamn ICU bed in 2 years. China built a hospital in 5 fucking days when this started. We haven't done that. We're still closing hospitals, and we're still letting private equity firms staff our hospitals, which is why we don't have enough people to work in hospitals, because they put the staff where the profit is. They don't put the staff where the need is, which is why we don't have enough ICU beds, because they're not profitable, and nobody gives a shit about that. But stay angry at your neighbor for getting sick. Don't get angry at your obese neighbor who won't stop eating donuts. Don't get angry at your diabetic neighbor who won't stop drinking alcohol. Don't get upset at your reckless driving neighbor. Don't get upset at your alcoholic neighbor who drive drunk and gets in an accident. Those people deserve those beds. Don't get upset at your chain smoking neighbor who needs a lung transplant. Those people deserve those beds. It's people who get COVID who don't deserve them. Hey, we're doing live stand-up comedy in Philadelphia on February 20th. We just added a second show. And February 26th, back here in Los Angeles, go to jimmydorecomedy.com for a link for all the tickets for all our live shows.